For a look at the administration's reaction to the bill, what comes next? We are joined right now by the Health and Human Services Secretary, Kathleen Sebelius. She is joining us now from the White House. Madam Secretary, thanks so much for the time. Congratulations, first of all, on the bill's passage in the House. I'm wondering, though, one of the things that we've been talking about this morning is this idea of Medicare reform. I mean, there's so much language about it in the bill, but to what extent are you worried about solvency?
Well, I'm really pleased that we have a chance to not only make sure that the Medicare Trust Fund is solvent for an additional 10 years. That's great news for seniors, but also that there's some real quality improvements in the bill, that we can eliminate the copay for preventive care, screenings that lots of seniors need. We close the so-called donut hole that affects so many millions of seniors who run out of help for their prescription coverage and often don't get the medicines they need to keep them well, and actually go after fraud and abuse in a really meaningful way. The Attorney General and I are co-sponsoring strike forces now in cities around the country, and we want to go after the criminals who are stealing money from the trust fund and return it to the trust fund, make sure that we keep the promise to America's seniors.
Secretary Sebelius, it's Lizzie O'Leary. One of the president's goals was to expand coverage, but the other was to bend the cost curve. But this compromise bill has taken out the biggest part of the bending the cost curve equation. That tax on high-end plans has been largely gutted. How can you still say this bends the cost curve?
Well, every health economist has agreed that every idea, Republican or Democratic, from economists across the spectrum, that has been raised to bend the cost curve is in this bill, including the tax on highest cost insurance plans. The timetable is rolled off a couple of years to make sure that people are on notice that this is coming, but it begins to change insurance company behavior right away. The good news is the Congressional Budget Office says in the first 10 years, this lowers the deficit by $100 billion. In the next 10 years, it lowers the deficit by almost $1 trillion. In the meantime, family budgets can get some relief because insurance prices go down. Small business owners get relief because they finally will have some bargaining power to have the kind of cost control that large employers have. So it's good news on the short front and in the long run.
Madam Secretary, some of the critics have been concerned about some of the timing, as you referenced there, just as far as when revenue comes in and then certain costs have to be spent. We only have about 20 seconds left. The best way to manage doctors and hospital costs?
Well, I think that the medical society and the nurses know the system is broken. So do the hospitals. That's why they participated in moving this bill forward. So the bill at the end of the day gives us the chance to pay less and really drive toward a higher quality system, pay for outcomes, which all Americans want.
We thank you so much, Madam Secretary, for your time.